Okay, I'm just going to tell you right now, I'm going to warn you for this upcoming segment that I'm talking about Dr. Anthony Fauci and him talking about the vaccine and what we should expect from it. There's going to be a lot of swear words, a lot of F-bombs. So if you don't want to hear those F-bombs, turn away right now. Coming right at you next. Last chance, get out of here if you don't want to be here. You still here? Still want to be here? Dr. Anthony Fauci is a son of a bitch. Is a fucking son of a bitch. Piece of shit son of a bitch. Lion sack of shit. I need to eat because I'm hangry right now. So I'm going to make it through this video. I'm going to post it tonight. This is my rant video. He's a fuckface. I told you if you want to be here, I'm going to swear because I'm pissed off. So if you don't want to hear a bunch of F-bombs, leave now. Leave. Get out of here. Dr. Anthony Fauci says chance of coronavirus vaccine being highly effective is not great. But we're going to inject it into everybody anyways. I'm going to put a bunch of my millions and billions of dollars into Moderna and into these vaccines. And I'm going to make a shit ton of money off of this vaccine. But I'm not guaranteeing you it's going to work. And, you know, spoiler alert, the reason I'm going to tell you it's not going to work and I'm going to put that right out there is because I don't want it to work. I don't want any of this stuff to work to actually take the fear away from you guys and actually cancel this coronavirus. I don't want that. We have got the golden goose laying egg, the golden goose, the goose that lays golden egg. Anyways, we have got the golden power punching goose egg popper pooper that's shooting out golden eggs for us right now. And those golden eggs are our control over you. We love the fact that we can have this forever and we can say, well, hey, it's not going to work. I mean, maybe 50%, maybe we get 50, 60%, maybe it works, but you're always going to have to, you're going to always have to keep your social distancing, wear your mask, and we're going to need to know where you are, and we're going to have to contact trace you, and it's always going to be a fear. We're going to stretch this out like after 9/11, terrorism was always out there. We could never eradicate it. It was always going to be there, and we were always going to be able to fight it. Well, coronavirus is going to be there, and we're going to be able to inject you and test these drugs and test these, and some are going to die and some aren't going to die. And I bet a lot of the people that die from these are just going to be like, oh, the coronavirus killed him. Well, it didn't work on him. And then when we start having babies that are growing out with little flappers on them, right? They're growing out little, they don't have the whole arms, and they're coming out and they're like, mama, and they have these little mutated flipping DNA, right? We're going to just say, oh, well, that's because of, you know, the food, or because they were like we're never going to blame the vaccine for that. So Dr. Fauci, and if you know anything about him, if you do any kind of history on him, why don't you read what he did to Judy Mikovits? Why don't you really look and see what he did to Judy Mikovits back in that day? Why don't you see who this scumbag, this short little, he needs a stool to get in a car, right? He probably needs what do you call them? The potty pedestals, the squatty potty. He probably needs a squatty potty just to get on the potty. This short little shit. This guy who acts like he's Mr. Oh man, he's Mr. Doctor Knows It All. He doesn't give a shit. He's in pharmaceuticals' back pocket, and he doesn't give a crap about you. Let's read the article. I just ranted for 3 minutes. White House coronavirus advisor Dr. Anthony Fauci said Friday that the chances of scientists creating a highly effective vaccine, one that provides 98% or more guaranteed protection for the virus, are slim to none. Scientists are hoping for a coronavirus vaccine that is at least 75% effective. 50 or 60 would work. That'd be acceptable to Fauci, director of the National Institute of Allergy and Infectious Diseases, said during a Q&A with Brown University School of Public Health. The chances of it being 98% effective is not great, which means you must never abandon the public health approach. We're never going to be able to fully abandon the public health approach and social distancing. Wear your masks. You know, no large groups. Need to track where you've been. We're going to contact trace you, right? Live in fear. The vaccine's never going to make everything go away. Because if everything went away, we'd have nothing to control and fear you out about. Put you in a lot of fear. You mean when I don't. You've got to think of a vaccine as a tool to be able to get the pandemic to no longer be a pandemic, but to be something that's well controlled. It's controlled. We're going to control it, and it's probably going to happen after the election, where then we don't have to be all freaked out, but we're still going to have control. We still need to control it, and by controlling it, we need to control you. That is what he's saying right there. It's not going to be a pandemic. We're going to be able to control it, but by control it, we mean control you. control you. And you need to give us your control. The Food and Drug Administration has said it would authorize a corona vaccine so long as it is safe and at least 50% effective. Dr. Stephen Hahn, the FDA's commissioner, said last month that the vaccine or vaccines that end up getting authorized will prove to be more than 50% effective. But it's possible the U.S. could end up with a vaccine that on average reduces a person's risk of COVID-19 infection by roughly 50%. We really felt strongly that that had to be the floor. 50-50. You take this shot, maybe you grow an extra eye, maybe you don't. 50-50, gotta be the floor. We're not gonna go 40-60 here, 50-50. If it's not at least 50% effective, right, we're not gonna do it, because we care about you. We're gonna pump this vaccine out, okay, follow me here. We're gonna pump this vaccine out that we have had 10 years to try to get done, but you know what? The side effects and the efficacy of it, it wasn't good. Way too many side effects, not good efficacy. So we never got this mRNA vaccine out to you. But guess what? In the last 8 months, we've really put our minds together now and a lot of money, and we're going to have that ready for you. Yes, it has a potential to make your baby grow an extra third leg and or have a flapper arm. But hey, 50-50, it's okay. We're going to inject it into you. Sounds fair. But for the most part, I think infectious disease experts have agreed that that's a reasonable floor. Of course, hoping that the actual effectiveness will be higher. We're hoping. A 50% effective vaccine would be roughly on par with those for influenza, which do shit to you, but weaken your immune system. But below the effectiveness of one of those of a measles vaccine, which is about 93% effective, according to the Centers for Disease Control and Prevention. Public health officials and scientists expect to know whether at least one of the numerous potential COVID-19 vaccines in development worldwide is safe and effective by the end of December or early next year. Even though they normally take 2, 3, 4, up to 10 years to develop, we're going to do it in, less than a year. Though there is never a guarantee. Drug companies Pfizer and Moderna, go back and watch my Moderna video that I did. Started about 24 minutes on my last video on the Moderna one, and I lay that all out. Both began late-stage trials for their potential vaccines last week, and both expect to enroll about 30,000 participants because they don't have any liability if they kill anybody or they make them grow an extra penis. They don't have any liability there. They don't have any worries because everyone's pumping money into them, so they don't have to come up with any R&D money. And they have now jumping full stream ahead, even though they've had 10 years to figure it out and couldn't figure it out this whole time with this mRNA vaccine. They're ready to do it now. It's going to work this time. Praise God. Let's give them a hand. Well done, Moderna. Well done. 30,000 people. You're dumbasses if you're going to be signing up for that. I think Fauci and I think the Moderna CEO and I think Stephen Bancel and I think all these other people should line up first. President Trump, Mitch McConnell, anybody, Bill Gates' grandkids, his family, his friend. I think all of those people should be the first ones to have to be tested. And they can't be injected with a placebo. It has to be like we have to be able to know somehow that they're really getting the mRNA. Those should be the first people to get tested up with it. Let's test all of Congress, all of the senators, all of our White House officials, all of the drug officials, drug company, all of the Bill Gateses of the world, all of social media, like Zuckerberg and all these other people that are censoring any kind of real speech on these, right? You motherfuckers should be the first one to have to get it. Fauci has previously said he worries about the durability of a coronavirus vaccine, saying if COVID-19 acts like other coronaviruses, it may not provide long-term protection. Good setup, Dr. Fauci. Good flipping setup on that one. So, the reason he said that right there is because he's like, get ready, you're going to need it every year. We're going to give it to you every year. Health officials say there is no returning to normal until there is a vaccine. Fauci's comments came a day after the WHO cautioned about the development of vaccines, reiterating that there may never be a silver bullet for the coronavirus, which means we got to continue doing what we're doing and continue having control over your lives, which continues to rapidly spread worldwide, like the flu does every damn year. The phase 3 trials underway do not necessarily mean that a vaccine is almost ready to be deployed to the public, the agency says. Phase 3 doesn't mean nearly there. Mike Ryan, executive director of the WHO's Emergency Health Program, said during a virtual panel discussion with NBC Nightly News anchor Lester Holt, hosted by the Aspen Security Forum. Phase 3 means this is the first time this vaccine has been put into the general population. Think about that. They've been trying to do it for 10 years, and phase 3 means, yay, we're there. It's actually being put into the population, into otherwise healthy individuals, to see if the vaccine will protect them against natural infections or make them grow a third penis or eye. While there is hope scientists will find a safe and effective vaccine, there is never a guarantee. WHO Director General Tedros Tedros, said, "We cannot say we have vaccines. We may or may not," he said, "but we're going to keep trying. And we're going to keep injecting you with full immunity for us having any kind of pushback or lawsuits brought against us. Fully funded by everyone who wants to make lots of money off this. Taking all kinds of money from American governments and every other kind of governments. And we're going to keep trying. And we're going to keep using it as our guinea pigs. Because you know what? We're here because we love you and want to take care of your safety." On Friday, Fauci reiterated that he is cautiously optimistic scientists will find a safe and effective vaccine, because he'll make a shit ton of money. He also reiterated that the coronavirus may never be eliminated, because he also wants to continually keep you in a shitload of control. But world leaders can work together to bring the virus down to lower levels, but we still need to manage them every year. Some of Fauci's comments have been at odds with President Donald Trump, who has repeatedly said the virus would disappear. When you say things like that, President Trump, I applaud you. When you push for the vaccines being given to us by the end of the year, I condemn you. Trump, who is seeking re-election, said Thursday that it's possible the United States could have a safe and effective vaccine for the coronavirus before the upcoming presidential election on November 3rd. Oh, man. We're being played at epic proportions. You need to wake up and not comply and push back, because they want everything. They want all control. They don't want to save you. They don't care about you. They don't love you. They don't want to help you. They don't want to make sure that you're safe. That is not what they do. They want to control you. They want to hurt you. They do. They don't, or I should say, they don't care if they hurt you. They don't care if they hurt you at all. They only care if they can control you. That's what they're trying to do. Don't let them anymore, people. Don't comply. Don't comply. Push back. Because if you don't, bad things are going to happen. Until next time, it's SJG Perspective. Please like and share, and let me know if you made it to the end of this 12 minutes. I'm sorry. I told you, I warned you, I was fired up, and I was going to use some swear words. So if you made it, you're a fucking rock star. Until next time, it's SJG Perspective. See you later. Bye.